Hello and welcome to Health Matters on Channels Television again. We're so glad to have you join us. I am Mary Alala Yusuf. Just recently, the Commissioner for Health in Delta State confirmed a case of Lassa fever, which was transferred to Anambra State. The patient, a doctor, died after 3 hours of management. Since then, the hospital where he consulted and the one where he was treated, both in Asaba, have been sealed for decontamination. Lassa fever is an acute viral disease endemic in parts of West Africa, Nigeria included, and caused by contact with the urine or feces of infected multi-mammate rodents. The Centers for Disease Control and Prevention say that there are roughly 100,000 to 300,000 Lassa fever cases annually in West Africa, out of which approximately 5,000 casualties result. My guest is Dr. Tochi Okor. She's a consultant public and occupational health physician, a healthcare epidemiologist, and a member of the Nigeria Infection Control Association. You're welcome to the program.
Thank you for having me.
Let's start with the case that has been widely reported around the country. My first question would be, I'm puzzled. We were told that Lassa fever was a dry season infection. And now we have the rains. So imagine the shock when we heard that there's a case of Lassa fever. Why now?
Well, in medicine, there are actually no absolutes. What we usually say, it's within this period and within this period. But what has been found out is that the epidemiological patterns of so many things are beginning to change, mostly due to some human factors, climate change. But then it's been found out that we had more rains from November 2015 till date, probably due to the El Nino effect. So people are suspecting that this has also helped in changing the patterns. But really, yes, we say it's a dry season problem, but it can really be, it's like when it spikes. But there's really no surprise when you see an occasional case outside the so-called dry season thing.
Okay, yes. But we were told that when bushes are burned, the rats get out, then they come and live with the humans, come and eat their food and stuff like that. Okay, so bushes are not being burnt. Are the rats now living with us?
What you observe is that we are encroaching into their niches.
Okay.
A lot of deforestation, tree felling is going on, and humans are getting deeper and deeper into where these rodents live. And also, these rodents yes, they live in the bushes, but they still come in to human populations. We don't necessarily have to burn bushes. Yes, during the dry season, that's when a lot of bush burning goes on. But a lot of human activities still incurs into the areas and the bushes where these
So where are the intruders?
No, you wouldn't say we are the intruders. It's just a whole collection of things that all come together to change the epidemiological patterns of some of these things. Human activity is contributing a lot to the change in pattern of these emerging and re-emerging infectious diseases, quite all right. But these rodents also, some of them actually live within human populations. They don't necessarily have to be deep into the bushes.
But we're not always hearing of Lassa fever, for example, like malaria. It is seasonal, even though we are shocked it's coming again. So are there times when these rats don't shed the virus?
No. The viruses are, these rats, the viruses are in them all the time, all through their lifetime, and they keep shedding it in their urine. But what happens is that you get these spikes when there's now a lot of, contact between humans and these rats. Okay. But also be mindful that about 80% of people who get infected, who get in contact with these things, do not develop symptoms, or they get very mild symptoms. It's usually 20 to 30% that will end up, that actually come down with symptoms. And that's why I say it's endemic. It's here with us all the time. It's just that there are occasions where it then spikes, and then you have these...
Okay, this doctor was treated for 3 hours before he gave up. My next question would be, why did it take so long? Since we have Lassa fever like every year, shouldn't we have a sort of system that can quickly catch, a disease like Lassa fever before it gets out of hand?
be clear, what do you mean catch a disease like Lassa fever before it gets out of hand?
As in identify the disease in a person before it gets out of hand. For example, it looks to me like the doctor had it for a while, and that was why he gave up shortly after he was transferred to Nsukka, to Nnewi.
Well, from the way I understand the case, I read it in the papers just like you did. By the time he was being brought to Nnamdi Azikiwe University Teaching Hospital, I think they already had an idea. When he came in, they had already suspected that it was Lassa fever. So they instituted all the appropriate things and he died. So in terms of the response at that particular point in time, I do not have enough information to discuss what went wrong or what went right there. But I would imagine that for them to know or suspect that it's Lassa fever, they did all the right things there. But look at the symptoms of Lassa fever. They mimic severe malaria. They mimic typhoid. In fact, some of the abdominal symptoms actually mimic appendicitis. And that's the dilemma we have in our own part of the world, where every fever is malaria. And then when it's beyond malaria, it becomes typhoid. And what that then brings to the fore is the need to begin to sharpen some of our clinical protocols and refine them. And what do I mean? We now have rapid diagnosis tests for malaria. So we should no longer, yes, exactly. So we should no longer call every fever malaria when we could quickly confirm if it's malaria, or at least to some reasonable degree, by a rapid diagnostic test. That's one. In terms of the diagnosis of Lassa fever, we are still limited because in Nigeria, there are actually 2 centers where you can confirm Lassa fever. That's the virology lab in Lagos University Teaching Hospital, and then the specialist hospital, Irua, Benin City, Edo State. So what does that tell you? It has to be a high index of suspicion. So oftentimes it's a game of elimination, especially when you don't have an outbreak.
But is the time enough for all this elimination?
The time,
since it's an acute viral disease, it means it acts fast?
By acute, it acts fast, but it's, the intensity of the presenting symptoms. You can actually institute treatment within 6 days with ribavirin, and the outcome, we usually had some positive outcomes. So in terms of the time for the diagnosis, I think if you act with a high index of suspicion and then get the samples on time and take them for diagnosis on time, you can actually, but then if you're dealing within the context of a contact or somebody who is under surveillance, then begin to develop symptoms. So you have more time now to act. The danger is usually that first case when we are not suspecting it.
And that's where my next question is. It seems as if there has to be a casualty before there's, response. And do we have to have a casualty?
We don't necessarily have to have a casualty, but in our own environment, we need to get our systems right.
What do we do for the system?
What we need to do, I am one person that is a bit uncomfortable when we think about control and management in silos. We had Ebola the other time, so we have to do things for Ebola. Now in Lassa, we have to do things for. We need to become a little bit more organized. By silo, do you mean like
reaction rather than being proactive?
Reaction rather than being proactive, and then infection prevention and control is very, very important in healthcare settings. Okay, I think we may just be digressing too much of it. Let's just come to even the transmission of this Lassa fever. I think that's a good place to come. There's the primary transmission from the rodents through their feces, their urine, and all that. That's how they get human beings infected. As communities, as individuals, we should begin to realize that truly cleanliness is close to godliness, like they say. And therefore, we need to begin to take our hygiene seriously.
Okay, so dirt is good for this animal to thrive?
Yes, I mean, you have to keep your environment clean. Clear the bushes around your home. And then community collaboration becomes important, because if you live in a community where you keep your own house clean and your neighbor doesn't keep her house clean, and these rodents still have opportunity to come to your own homes. So community hygiene for Lassa fever is very, very critical. We must make sure that rats do not have access to our foods. They do not have access to our utensils. everything must be covered in rat-proof containers. That is one.
Let me pause you there before we get to two. We need to go on a quick break.
All right.
Let's go on a really short break. Stay with us. The best is yet to come.